Welcome, Dr. David Cortell from Cortell Chiropractic, March 22nd, Thursday, 2020. And I've been receiving quite a number of requests from people that I know, patients, friends, colleagues. Hey, do you have any face masks? Do you know where I can get a face mask? I don't. If you're not in direct patient care in a hospital or clinic setting where you're seeing patients with the virus, there's really not face masks available unless you have a stockpile. And if you do, maybe share them with somebody who's in direct patient care. I'm going to show you, however, several options that do show promise in preliminary studies at blocking some, if not most, of particles or viruses that might be coming through. So I'm going to show you three. The first one is a balaclava. You might have these if you're a skier or if you do any outside work in the winter time. They're also known as a head sock. And the way that you use them is you put them on over the head like this. And then you can have it over the head or you can bring it back this way. It does affect the way you speak. What I'm going to do is I'm going to add a second one as well. The reason we're adding the second one is because the fabric has an ability to block some of the particles, some of the virus, but you're going to want to have another filter in between. And a good filter is a piece of tissue. So you put a piece of tissue over the mouth, then you bring up the second. And then this way, every time I take a breath in, I'm breathing through the tissue. It works okay. It's not fantastic. If I put my glasses back on, my glasses will fog up, and I'll show you how to avoid that at the very end. The second thing that we can use, and they might be available to you, are bandanas. And a bandana is a very easy tool. You take a bandana, fold it in half. When you fold the bandana in half, you can take that same piece of tissue, put it right in the middle, and of the two, I do prefer the bandana. And the bandana goes like this, and then I'm going to place this right over my nose and mouth area, and tie it behind my head. As you can hear, it's not the easiest to speak through, but when I tie it up, hang on. When I tie it up, every time I breathe in, the tissue goes to my mouth. And as long as I'm not breathing through my nose, it works. If you don't have a bandana, and if you don't have a balaclava or a face mask, the third is a pair of men's underwear. Don't laugh. My office manager clued me in on this, and it really does work. So the way that you do this is you take a pair of men's underwear, clean is preferable, these are very clean. You put it over your head through one of the holes like this. You then take a second one. You take a second one, put it over the head as well. And then we fit in our tissue in between and place it back up. Now, as I breathe in, I'm breathing through the tissue, and I'm breathing through 2 layers of fabric. Through the tissue, 2 layers of fabric. I can also use it if I want to rob a bank. I can do this. So, not that I'm robbing banks, but these are 3 different ways that you can effectively try to create a face mask for the house. The way that we stop breathing through our nose, you take 2 small pieces of cotton and you shove them up your nose while you have the face mask on. If the cotton is up the nose while the face mask is on, you're going to be prompted, because of the resistance through the nose, to breathe only through the mouth. And then I would have, of course, a piece of tissue in between. These are very effective ways for you to help to keep your body safe, to avoid having any sort of virus exposure through the mouth. Of course, we want to keep our hands clean, wear gloves, everything else, but these are 3 effective ways you can filter the air you're breathing. Good luck, stay safe, and tune back in for the next posting.